All right, well, welcome back, everyone, to our second podcast. Today, we have a very special guest, Dr. Hunt. Thank you so much for being here today. Why don't we just get started and kind of go over what you do and your background, and we just go from there.
Yeah, thanks for having me. I'm really excited to talk to you guys and talk about your product. So I am a family medicine physician, and I originally practiced hospitalist medicine, meaning I only saw patients in the hospital. But for the last few years, I've been doing geriatrics, so like care of older adults. So your product has become very important to me as people age and they have more health concerns that I think CBD can really help with.
Oh, that's awesome. So geriatrics, what hopefully I said that right.
Yes.
What age span is that? Like what?
65 and older.
65 and older?
But honestly,
okay.
Most of my patients are in their 80s and 90s, which is awesome that people are able to have like a great quality of life for that long. But on average, I'd say like 85, 90.
85, 90. Awesome. So I've explained what CBD is for a very long time, and I think people are tired of hearing it from me. So coming from someone in your position, what is CBD?
CBD is a cannabinoid, so it's a chemical compound. And when I talk to my patients about it, I always say this is not THC. So it's not going to get you high. It's basically missing the psychoactive chemical. So we get a lot of the benefits from the marijuana plant, like the pain relief and the anti-anxiety benefits, without the high effect. So
right.
That's why CBD to me is really exciting, is because we've been able to isolate this compound and just get the benefits without some of the undesirable things that people don't want from the THC.
Yep, absolutely. And so being in the medical field, I'm sure you see pretty much everything. What are some of the main benefits that you've seen CBD being used for patients?
Yeah, so I think it's important to say, first of all, that there is a CBD medication approved by the FDA on the market, and that's for a very specific kind of epilepsy for kids. So otherwise, when we talk about CBD, it's not FDA approved, which doesn't mean anything other than that it's not a traditional pharmaceutical. But some of the things that we've seen and that research is exploring is pain relief, anti-anxiety, insomnia, and it's really exciting because it comes in different formulations. So depending on what our patients need, we can use different forms of it. So topical, like a cream, oral, like a gummy or a tincture. And for our older folks, what we really like it for is the pain relief, because we're not getting the side effects that come with these traditional opiate pain medications that are not great. But we can still offer some pain relief for like chronic low back pain, even like migraines, things like that.
Yep, it really has come in full form. I think at first, and I guess around 2018 when that Farm Bill passed, it seemed that people were they weren't too sure about it. Yeah. And I look today, and there's over 1,000 studies like actively being done about CBD and the benefits of it. So it's amazing to see how far it's grown, and it's going to continue to keep going that way, I think.
Yeah, absolutely. I think the initial research is really positive. And like you said, Nate, there's new information coming out all the time. And it's really become a focus, which is really exciting.
Yeah. So if you were to talk to someone who's on the edge about CBD, they're not too sure if they want to start with it, they're not sure if it's going to be beneficial to them or if it's going to work, what would you tell them?
So first of all, and thank you for bringing that up, you should always talk to your physician before you start anything over the counter, right? Because CBD is really well tolerated and it is really safe, but it does have a few medication interactions, especially blood thinners. Yep. So you should always just chat with your doctor. But usually I tell people, it has fewer side effects than a lot of the traditional pharmaceuticals that we use. So if we're talking about joint pain and we're talking about starting someone on like an anti-inflammatory, like a prescription strength of like Advil or ibuprofen, for example, those have a lot of things we worry about with the kidneys and the stomach. And long-term use is not desirable. So the nice thing about CBD is we might get some pain relief from it without having to worry about a lot of those long-term health issues. So I usually tell people, I look at their medication list and I see with their, past history, is this going to be safe for them? And then I usually tell them, give it a try. I think one of the great things about CBD is that we can try it and we'll see the benefit if we're going to get it pretty early. So it's not something that you have to say, you have to use it for 6 weeks and then we'll know. No, you'll know pretty soon if this is going to help you. And that's great, because then people can either commit to using it long term or go back to their doctor and find an alternative if they need to.
Yeah, that was great. So I always think that, I guess in my experience being in this industry for so long, I've noticed that using a tincture sublingually, I think that might be a little bit more effective than gummies, but at the same token, people really like the gummies and they're easy. So what is your take on all of that? Do you still get the same absorption and everything, or?
Yeah, that's a good question. And actually, CBD is really interesting because the absorption in general is actually not great. So we do want higher dose CBD product, which is something that I like about your company, is that you do tend to have higher CBD doses, which means patients are going to get more benefit and kind of more bang for their buck. But I just individualize it to the patient. So like, you're bad at taking medicines, you don't like taking pills, maybe you'd like a gummy because it's kind of a treat. Exactly. Or maybe you have dental problems, and so a gummy really isn't the way to go. The tincture might be better. But I do agree with you. I think the tincture, from what I've seen, has a little bit better bioavailability and maybe works a little bit faster for people. But really, it's great that there's so many options and people can pick what's going to work for them.
Absolutely. And you get a sweet treat if you want to have a gummy at night.
That's right.
So I guess you touched on it a little bit, but why, I know you've been a customer of ours for almost 4 years, I think.
Yeah.
Well, thank you for that.
Yes.
And what have you noticed about our products compared to others?
Yeah, good point. And I have to just say before we go on that I don't have any like financial stake in the company. I think that's important for people to know. I don't have any financial disclosures, so I don't get like products or money for doing this podcast. I just do it because I love your product, and the marketplace is flooded, unfortunately, with garbage product, and yours is really good and your company has integrity, so that's why I'm here. But there was a study done that Mayo Clinic reported on, I think in 2023, and they studied a bunch of CBD products that they ordered online to see, does it have the amount of CBD that it claims to have. And the majority of the products had 25% or less of the CBD than it said that they had. So that, if you're the customer, is really disappointing. Yep. Because insurance doesn't cover CBD. That's the reality. I'm paying for something. I would like to get what I'm paying for, and a lot of companies are not reliable. So they'll just say whatever on the label, and you don't know if what you're getting has what you're paying for. And almost more importantly, we don't know if it's contaminated with things like heavy metals, pesticides, things like that, right? Because don't forget that these companies aren't FDA regulated. Yep. So what we really need is a company that has independent lab testing and the product has what it says it has and doesn't have other things in it, like THC or heavy metals or pesticides. Yep.
Yeah, and it's super important. I'm glad that you said that. So I talked about on the last podcast, I'll just briefly go over it, but I had a customer come in and they had a jar and it said like 500,000 milligrams or something like that, and it's just not possible. And so I reverse image searched it, and it was a bottle that was being sold from China and shipped into here, and someone actually tested that bottle out and everything else, and there was pesticides in there, there was herbicides in there. So you just never really know what you're getting, and you have to be safe when you do it. You don't want to just go for the convenient option on Amazon, and you really just need to do your research. But I guess we can go to the next topic of things. So what's a good, because you recommend it to your patients, at least as the first option, and then obviously then go to other things. But do you have a good success story for us that some of our viewers can hear?
Yeah, like I said, I do work with a lot of older adults. So I think a lot of the common complaints that we see is like insomnia, number one. Chronic pain, maybe joint pain, back pain, that's a common one. And then anxiety is the other. And these are three areas that I'm really kind of passionate about alternative treatments for, because the pharmaceuticals that we have for them are either not great or they have a lot of side effects. And I'm like pro pharmaceutical, right? I'm a doctor. I write prescriptions every single day. But these areas, I think we don't have great treatments for. And this is where I think people can really be helped by CBD after you talk to your doctor. So I have like a lovely patient who had severe knee pain, and she'd been seeing an orthopedist, and he really was strongly recommending for her to get surgery. He said it's bone on bone. It's bad, and she'd been doing physical therapy and had gotten the joint injections and nothing was helping. And she just said, I really don't want surgery. I just want to be able to live my life and, at least have a manageable amount of pain every day. I don't even need to be pain-free. And so she got your topical ointment and loves it. And
the joint and muscle salve?
Yes, okay. Thank you. And she uses it like 3 times a day, and like she said, she's not expecting to have zero pain, right? But it
Yeah. makes
makes her pain like so much more manageable, and she can do everything that she wants to do, and she doesn't have to have knee surgery.
That is
that's been
awesome.
huge.
We love that. I like to see CBD as a kind of like a natural anti-inflammatory in a sense. And it's just so great for people to be able to use something like this that comes out of a plant and as the first option instead of having to go down the other routes. And I've just seen myself every day I learn something new. I even had someone that said it helped with their asthma, which I've had asthma in the past. It hasn't helped me as much, but everyone is different, right?
Yeah.
And it's going to affect you in a different way.
Yeah.
And with your CB1, CB2 receptors in your body, they deal with pretty much everything. So it's awesome that we've had you on the podcast. Thank you so much for coming in, and we'd love to have you again. And we can talk about some other things. I'm sure that this industry is going to keep continuing to evolve.
Yes.
So any last touches on there?
No, thank you for having me.
Yeah.
Yeah, like I said, talk to your doctor, of course, before you add anything new, but don't be afraid to bring it up with your physician, right? So if you go in and you're having pain, don't be afraid to ask them, hey, what about CBD? And then make sure that you pick a company that has integrity so that you're getting what you're supposed to be getting.
Right. Well, thank you guys for watching. Thank you so much for being on here. And we're actually going to be posting a link at the bottom of our video, and you guys can go on there and vote on what the podcast name should be. So hopefully we get some fun answers and we get that solidified, and we'll see you on episode 3. Thank you very much.
Thanks.